In this question, we have an 18-year-old woman that was admitted with multiple injuries sustained in a traffic accident that pinned her between a building and an automobile. Now, resuscitation was initiated on the young woman during transport. An oral endotracheal tube was placed, manual ventilation was started. Massive hemoptysis was noted following intubation. Upon arrival in the emergency department, the patient has a heart rate of 50 per minute, blood pressure of only 80/50. She is apneic and hypothermic. Okay, the adult critical care therapist should report that this patient is suffering from, well, they're clearly suffering from shock. They got a blood pressure that's way down there. Okay, the heart rate is also dropping. She's not breathing. Her temperature is dropping. So this is a severe shock, and we need to identify what kind it is. When you come down to the options, A says septic shock. Well, that would be due to a very significant infection, and that's not what we have here. This is some kind of trauma. Neurogenic shock would make sense. If she got banged up, her head, her neck, her spinal cord, nervous system, that certainly could send a shock through her body and cause this to happen, so that's a possibility. Cardiogenic shock is saying that she's just had a massive heart failure, and given her age and history, that doesn't sound like that's what we're dealing with, it's a heart attack. Anaphylactic shock is shock due to an allergic reaction to something. You were, stung by a bee, or you had some kind of allergic reaction to a medication or something like that. That's not what's going on here, so we can eliminate that one. So since it's not septic or cardiogenic or anaphylactic, that really leaves only neurogenic, which makes sense. Giving the multiple trauma, that could include trauma to the nervous system, and that would in turn then just vasodilate everybody. And blood would pool, pressures would fall, temperature would fall, all of the things that we see happening. That is the best answer here, and that is the correct answer, letter B.